Hi there, and welcome to our third video in our series on hormonal disorders that can masquerade as mental health related concerns. In this video, we're going to be talking about the chronic stress hormone cortisol and how it can wreak havoc on our health, increasing our risk for many physical and mental health related concerns. Now, I do not want you to fall into the trap of thinking that this only applies to individuals who've experienced abuse in childhood. This could not be farther from the truth. In this video, we're going to be talking about why this information is relevant to every patient and how we can use this information to help our patients improve their physical, mental, spiritual, and social well-being. Stay tuned. If you've been following our channel for a while, then you know that I am planning on doing an in-depth, a more comprehensive training on mental wellness and helping individuals improve their physical and mental health, but specifically from the angle of improving mental health in order to help people live optimally and help spread the three angels messages and help people just experience peace, and I've shared in many videos on this channel that this is really the foundation of our work. This is the foundation of our health message. Historically, the Adventist Church and the Adventist health message has been one that focuses on mental well-being when other voices were silent. Okay. And so if you are interested in learning more about how to optimize mental health by looking at physical and physiological factors, kind of like what we've been describing so far, then I'm going to invite you to fill out the form that you'll see in the description box below this video. And I'll also place it in a comment and pin that comment. Fill out that form so that we can have a brief conversation, and I'll keep you in the loop about the upcoming training. Okay. So, that's what my invitation to you is today, and let's continue on with our video. Okay, so our third and final hormonal condition that could be masquerading as a mental health concern is HPA axis dysfunction. So hypothalamic pituitary adrenal gland dysfunction, and our key hormone here is cortisol. Okay, so when we experience chronic stress, our hypothalamus, which is located in our brain, secretes a hormone called corticotropin releasing hormone, CRH. Now, CRH circulates throughout the body and it stimulates the pituitary gland, which is also in the brain. And the pituitary gland then secretes ACTH, which is called adrenocorticotropic hormone. Okay, that ACTH circulates throughout the body and it stimulates the adrenal cortex. Now, your adrenal glands are two glands that are located directly above your kidneys. So the ACTH is going to stimulate your adrenal cortex, and it's going to cause the adrenal cortex to secrete cortisol. So cortisol, again, is our main chronic stress hormone. And now cortisol plays an important role in the body, and it actually has the ability to alter the function of every single system in our body. Okay. And this is important because to me, it really shows how much care God put into designing the human body. Okay. Now, why do I say that? Think about it like this. You may have noticed, or you may have heard, so you know that if you're a female, you may have noticed that when you're under a lot of stress, it can kind of throw off when your period comes. Okay. Or you may have known like some gymnasts or competitive athletes, how when they lose a certain amount of weight and their body is under a certain amount of stress, or like physiological stress. So not necessarily mental stress, but like physiological stress. So like with a lot of weight loss, a lot of exercising, it can throw off their reproductive hormones and cause their periods not to come, or things like that. This is partly due to cortisol function. Okay. And the reason that I say that it shows how much care God put into the human body is because if you are in a state where you're physiologically stressed or mentally stressed, do you really need to be fertile at that time? No. Like similarly, if you are running from a lion, okay, cortisol can cause your gastrointestinal, like your GI motility, to kind of stop, so it can arrest your digestion. Because do you really need to be digesting food in the moment when you're running from a lion? No, you don't. What you really need to be doing at that time is making sure that your muscles have enough energy so that you can run and get away and live to see another day. Okay, so the fact that God created us with this hormone that in the setting of chronic stress can alter our other body systems in order to conserve energy and ultimately preserve life, to me that is like just a testament to how loving he is, how wise he is, how powerful he is. And it's just, just very, very encouraging to me to know that this God is on my side, so but I digress. Let's get back to what we're talking about. So God created us so that cortisol can kind of alter all of our body systems. Okay. And that is important because it shows us how chronic stress can negatively, in a lot of cases, impact our physical and our mental health. So we're going to talk just briefly about adverse childhood experiences. So chronically stressful events during childhood and how they change the brain and the body. Okay. And we're also going to kind of touch on the bidirectional relationship between physical and mental health, which we've already kind of addressed. We've talked about how stress can cause changes in can cause cortisol secretion, which then causes changes in all of the body systems. We'll talk a little bit more about that as well. So, adverse childhood experiences. So there was a study done in collaboration between Kaiser and the CDC many years ago, and it was called the ACE study, the Adverse Childhood Experiences Study. And what they found was that there are certain stressful life events that could have occurred in childhood, and that these life events, individuals who experience these life events, were at increased risk for certain physiological conditions. And so like autoimmune disease, reproductive function, reproductive hormone dysfunction, metabolic syndrome, so like diabetes, things like that. And also, of course, mental health concerns. Okay. So they looked at specifically 10 different adverse childhood experiences. And I'm going to go over those 10, but I'm also going to go over some of them that weren't looked at in those studies, but that can also elicit the stress response and lead to increased risk for certain physical and mental health conditions. Okay. Now, before we get into the actual adverse childhood experiences, I want to point out that the way that these experiences change our brains and bodies is that most of the time, in most cases, they can cause hyperactivity of the stress response. So what that looks like, or what that often looks like, is a person's heart rate may go up really quickly, when they do experience something stressful, or it's just like a hypersensitivity of your stress response. You may feel that, when you get stressed, things just, your stress tolerance is low. It can lead to more anxiety, more depression, things like that. In some cases, and this is usually what happens in individuals who end up going on to be diagnosed with PTSD, you see a hypofunctioning of the stress response. And this is where their stress response has been elicited so frequently in childhood that, or in earlier life, because it can happen in adulthood as well, that now when they experience something stressful, it's difficult for the body to even mount a full stress response, So you can have hyperfunctioning of the HPA axis, which is most common, or in some cases of PTSD, you can see that the individual goes on to develop hypofunctioning of the HPA axis. And both of these states are, like something that you wouldn't want to have. And both have been associated with increased risk for certain physical and mental health conditions. But it's important to note that God can overrule all of that. There are things that we can do for ourselves and for our patients to help them, like to help reduce their risk, or if they've already been diagnosed with these conditions, to help reduce the effect of this condition on their quality of life. So there are things that we can do. Okay. All right. So now let's get into the specific adverse childhood experiences that research has demonstrated have been associated with increased risk for certain physical and mental health concerns. Okay. So parental divorce or separation, substance use in the home, domestic violence. So that's, abuse of a caregiver or abuse of the children. Okay. Mental illness in the home. So having a depressed mom is one that is like significantly associated with increased risk for other conditions, but it also can be any mental illness and any family member. Okay. Parental incarceration. So if you have a parent who was in jail growing up, that can be one. Sexual abuse, physical abuse, verbal or emotional abuse, physical neglect. So not having the food, clothing, shelter that you need as a child, or emotional neglect. So not, having parents who tell you that they love you and who take care of you, and having emotionally distant parents. All of these things can be considered emotional neglect. Okay. Poverty, bullying, caregiver death. So having your mother die or your father die, or your grandmother who took care of you dying, those things can elicit a chronic stress response in childhood. The death of a sibling, being, raised in foster care, racism, severe accident. So being involved in a severe accident can cause significant elicitation of the stress response. Chronic illness in childhood, being involved in a natural disaster like the earthquake in Haiti or the tsunami in Southern Asia that took place. These are things that have taken place in our lifetime. Community violence, so growing up in a place where there's gun violence outside and you have to duck, things like that. Being initiated into the juvenile justice system. All of these things can elicit the stress response chronically in childhood, and they can lead to hyperactivity or hypoactivity of the HPA axis. So they can lead to HPA axis dysfunction, which again increases the risk for metabolic conditions. So like, heart disease, diabetes, things like that, hyperlipidemia. So they can increase your risk for reproductive health conditions, like PCOS or like infertility, things like that. They can increase, fibroids, all of these like reproductive health conditions. They can increase your risk for autoimmune diseases. So things like lupus, rheumatoid arthritis, Sjogren's, scleroderma, all of these things, and Hashimoto's thyroiditis, which you've been talking about. And they can also increase your risk for mental health concerns, anxiety, depression, bipolar disorder, schizophrenia, PTSD, all of these other OCD, mental health concerns. So they can increase our risk for all of these things. But again, we do not have to succumb to them. Increased risk does not necessarily mean that you will be diagnosed with it. There are other factors. This thing is multifactorial, and there are things that we can do to help our patients and clients so that they're able to live the most abundant life that they can live given their circumstances. And again, I want to highlight before we move on the fact that, yes, I mentioned things that can happen in childhood because at that time our brains and bodies are still developing. That is when we are most at risk for the chronic elicitation of the stress response changing our brains and ultimately changing our bodies as well. However, even if you experience a significantly stressful event in adulthood, after your brain has already fully developed, you still can experience increased risk for these conditions. As a matter of fact, there has been a significant correlation between a significantly stressful event in adulthood rather, and the development of an autoimmune disorder shortly after. There is research on these things. So it doesn't necessarily mean that if you didn't experience a childhood associated chronic stress experience, then this can't happen to you, because it can. Okay. But again, as I mentioned, there are things that we can do, and we have to educate ourselves so that we know what we can do in order to help our patients and help ourselves. All right, so let's look at this. Cumulative childhood stress and autoimmune diseases in adults. This study says childhood traumatic stress increase the likelihood of hospitalizations with a diagnosed autoimmune disease decades into adulthood. So this is what we've been talking about. Here's another one. Impact of adverse childhood experiences on the symptom severity of different mental disorders. Okay, so here we're looking at how adverse childhood experiences can affect symptom severity, or how severe the symptoms are in different mental health concerns. So it says, moreover, 25.8% of patients with substance use disorders reported childhood trauma, which was significantly higher than found in the other 4 psychiatric disorder groups. Emotional abuse scores were positively correlated with disease severity. The higher the total trauma score, the more severe the mental disorder. Okay, so this is something that I think intuitively we know. We know that if you experience more stress during childhood, you're much more likely to turn to substance use in adulthood to cope. And I think we know also that the more stressful your childhood environment is, the more likely you are to develop severe mental health conditions in adulthood. But it's nice to know that there's research that corroborates this idea as well. Okay, so adverse childhood experiences lead to HPA axis hyperactivity, immune system dysregulation, and brain changes. And they can significantly increase our risk for mental and physical health concerns as adults. Okay, ACEs can also lead to the development of maladaptive thought patterns, which can affect the way we view ourselves and others, our relationships, our careers, and every other area of our lives. Okay, so now let's talk about what we can do to address these things. Okay, because what I don't want to do is just share a ton of things that are going to go wrong because of something that you and your patients cannot change. You know what I mean? We can't go back in time and change like our past. But what we can do is implement these simple interventions moving forward in order to give our bodies the best chance and our minds the best chance to live optimally. Okay, so let's see. Green space and stress. Evidence from cortisol measures in deprived urban communities. So this study said higher levels of neighborhood green space, so we're talking about trees, grass, flowers, things like that, green space, were associated with healthier mean cortisol levels in women, whilst also attenuating higher cortisol levels in men. So here we saw improvements. We saw that when women were able to spend more time exposed to green space, and this is specifically looking at women who live in a city, so in urban environments, when they were able to spend more time, let's say at parks or, otherwise exposed to green space, they had more healthy mean, so average, cortisol levels. And the men, even if they had higher cortisol levels, if they spent time exposed to green space, they didn't see as much of a negative effect from the higher cortisol levels. So that's what this is saying here. Okay, it says, we conclude that higher levels of green space in residential neighborhoods for this deprived urban population of middle-aged men and women not in work are linked with lower perceived stress and steeper or healthier diurnal cortisol decline. So basically what this is saying is that we see a healthier pattern in their cortisol levels, their daily cortisol levels, and when we talk to them, they say that they feel less stress. So if you ask them to rate their stress levels from a scale of 1 to 10, those who are exposed to green space, who have more access to green space, tended to say a lower number. So they had a lower perception of stress. Whether or not they actually were under less stress, we don't know. But what's really important is your perception of how stressed you are, because that, we're told that 9/10 of all diseases have their foundation in the mind. And a lot of times it's your perception of your situation that leads to the stress response taking place, and not necessarily the situation itself. Okay, it's your ability to cope with the situation, or your perceived inability to cope with the situation that actually affects you physiologically. Okay, so the takeaway from this is, make sure you're spending time exposed to green space. Make sure you're recommending this for your patients, because this leads to healthier cortisol levels and an improved perceived stress level. Okay. All right, green space, air pollution, traffic noise, and saliva cortisol in children. Okay, the PIAMA study. Okay, the conclusion of this study said residential exposure to green space in a buffer of 3,000 meters may be associated with lower stress levels in children 12 years of age. So if you have children, let's say you treat children, if you treat children and they are, maybe not in the best living situation, if you can recommend spending time in green space, that can serve as that can actually lead to lower stress levels in these children. So this is something to really harp on with our patients who are pediatrics and with really any kids that you come into contact with. Okay, so key takeaways. This is our summary. Hyperactive HPA axes continue to wreak havoc on our bodies even into adulthood. And in addition to prayer and therapy, these interventions have been found to modulate cortisol levels and or HPA axis activity. Okay, so we're going to talk about a few other things here. So we're going to talk about things that we can actually implement that have been associated with improved or more regulated cortisol levels. So first of all, stress management, deep breathing, heart rate variability training, and CBT, so cognitive behavioral therapy, CBT-based activities and other forms of stress management can help reduce perceived and actual physiological stress, okay, and psychological as well. Okay, number 2, green and blue space. So exposure to green and blue space for as few as 20 minutes has been associated with significant reductions in levels of the stress hormone cortisol. Okay. Adaptogenic botanicals. Adaptogenic botanicals like ashwagandha, Withania somnifera, and rhodiola, which the botanical name is Rhodiola rosea, have been associated with reduced cortisol, anxiety, and depression. Okay, and finally, some probiotic strains. Okay, so some beneficial probiotic strains, such as Lactobacillus plantarum, have been associated with alleviated stress and anxiety and enhanced memory and cognition. And of course, there are a lot more other things that can be done in order to help modulate cortisol levels and to help normalize the HPA axis function. But we can't go over all of these things here. I would say if you're interested in this type of thing, as I've been saying throughout this video, make sure you fill out the form below. And we'll chat a little bit and I'll be able to give you more information about our upcoming training program. All right. And this here is just references from, the previous slide. So if you would like to look more deeply into the research, go ahead and screenshot this slide. All right. Okay. Now, this is a quote that I wanted to share from Testimonies for the Church, Volume 5, page 444. It says, "The physician needs more than human wisdom and power that he may know how to minister to the many perplexing cases of disease of the mind and heart with which he is called to deal." Now, I would add that this is not just physicians. This applies to anyone who works with patients who may be experiencing diseases of the mind and heart. So we're talking physicians, nurse practitioners, PAs, dentists, nurses. We're talking patient care techs, CNAs, medical missionaries, anyone who is dealing with individuals in arguably their most vulnerable state needs more than just human wisdom. Okay. It says, "If he is ignorant of the power of divine grace, he cannot help the afflicted one, but will aggravate the difficulty. But if he has a firm hold upon God, he will be able to help the diseased, distracted mind. He will be able to point his patients to Christ and teach them to carry all their cares and perplexities to the great burden bearer." So this just really underscores the importance of us having a firm connection with Christ so that we can then go on and help our patients, help our clients, help the people with whom we interact to lay their burdens and their cares at Jesus' feet to help them to improve their physical health, their mental health, social health, spiritual health, to improve in every single aspect so that they can experience optimal life here on this earth and the hope for a life to come. Now, this integrated type of work, as I've mentioned, is in our DNA as a denomination. An integrated work that addresses physical, mental, spiritual, and social contributing factors to the disorders that we typically view as strictly mental is what is needed now. This is the work that Christ is calling us to in order to effectively address the current mental health crisis. Christ is calling us back to an integrated work. And as I've mentioned, if this is something, if there was anything that I've mentioned that by God's grace spoke to something that Christ has been revealing to you as far as his will for your life is concerned, go ahead and fill out the form in the comment below, the pinned comment, and also in the description box. Let's have a conversation and let's see how we can collaborate to ensure that you are thoroughly equipped in order to fulfill God's will for your life.